4North is a family. You know, between the nurses, the patients, the families on this unit, they've formed bonds together.
From the very first person we met at the door to upstairs, the doctors, the nurses down there at Costas. 4North is awesome. All the nurses, it's like, you know, this is the best place you can be.
There's laughter, there's celebrations, you know, there's parties going on up there from time to time. So, you know, it's, you know, you come to work and you're in that environment, it's not such a bad thing.
I met a lot of my friends up on the 4th floor. I'm actually one of the guys that was up on the 4th floor with me, and I talk to them all the time, we hang out.
All the nurses are exceptionally, they're so good, they're so wonderful, and make you feel so good, and that he's going to be okay, and it's going to be a long, long road, but we'll get through it.
Our kids are very sick. The care that we provide is very critical. We have patients who might spend a few days all the way up to a couple months. We've even had patients who spent up to 5 to 6 months on the unit.
The oncologist came and gave me Joey's diagnosis. I couldn't hardly take it in because it was so devastating.
I don't think they told me initially that they thought something was wrong with me, because they didn't want me to freak out. They did talk to my mom about it though, and I could tell that she was a little bit more on edge since they had that conversation with her, but I still didn't expect my cancer to be bad.
He was at his other grandpa's house and playing, and he felt something and came home, brought him home that night and told us about it. We was at the doctor the next day, said, "Here, I got you guys set up an appointment at Costas Center at Cardinal Glennon." He was diagnosed with rhabdomyosarcoma, which is a soft tissue cancer.
Kids that come in with a brand new diagnosis tend to stay longer. You know, some of our patients who have leukemia, for example, might be in the hospital for 4 to 6 weeks. You know, we've even had a few kids who've had some complications, maybe infections or you know, something that needs more intensive treatment, who've stayed for 2 or 3 months.
1 week, everyone was starting their senior year, so whenever I started seeing posts about, oh man, I gotta wake up at 6 a.m. to go to school, I was like, wow, I gotta wake up at like 6 a.m. to get chemotherapy. I kind of wish I was waking up for school.
This is the original part of the hospital, built in 1956. We have been able to move from semi-private to private rooms. However, within those private rooms, they're still smaller.
When your child is diagnosed with cancer, you move in. I mean, you're there for weeks, months. And what they need to have for these kids are rooms that are spacious enough for their parents to be able to stay with them.
We're constantly telling the families, you gotta wash your hands, you gotta be clean, we gotta avoid infection. And then we bring them into what should be the cleanest atmosphere that they're staying in, and they have to share bathrooms oftentimes with other families.
I've had a nurse come in, we didn't unlock the door, they didn't unlock the door, so they got to come in and do all that. So it'd be awesome to have their own bathrooms, you know, and that way they don't have to worry about it.
Why don't you like the bathrooms?
Because it's too small for me.
It's pretty crowded and tight in there.
I do know that since I've been here for the past 3 years, the staff have always expressed their disappointment with the physical conditions on the 4th floor. Knowing that we provide exceptional nursing care and medical care to our patients, but the physical conditions aren't up to standard.
Shower time, we would have 20 to 30 people, including parents, up on the same floor sharing a shower. So I would ask my mom to go down there, see if there's anyone in line waiting, because there was no way I was going to be waiting in line and not like want to throw up while standing there.
It took him forever because he was just imagine feeling that sick and trying to get yourself cleaned up.
What would make that place better?
We have a big room and a bigger playroom.
Why do you want a bigger playroom?
So so a lot of people can play.
What we're excited about is making the rooms larger, having centralized air, having room for a parent sleeper couch so 2 parents can spend the night with the child, having enough room for the nurses to maneuver around and care for the child, private bathroom with a private shower, so the kids don't have to worry about the risk of infection.
They need a place to stay that reflects the caliber of care that Cardinal Glennon gives to them. The nurses and doctors are second to none. I would never want to send my son anywhere else.
If everybody can see it in their hearts to help kids like this, would be beyond belief, because that's what I'm going to do if that ever comes to my advantage. Kids first.
That's really what our goal is to provide the best care possible. And we do a great job, the doctors, the nurses, all the staff, and I think we can just do a little bit better. And renovating 4North is one way to do that.
Your money is going to a really good cause, going to kids who are sick. It's not only going to that, it's like going to, sorry. It's just making a more comfortable atmosphere for an already hard situation.